In a press conference meant to lay out Oregon's new plan for vaccinating teachers and seniors over 65, Governor Kate Brown instead addressed other vaccine news, the lack of a federal reserve of doses.
It was certainly shocking for our teams, as just a few days earlier, we, like the rest of the country, heard HHS Secretary Azar's announcement that the federal government was releasing the entire federal supply to help the states expedite vaccinations.
Governor Brown pointed blame directly at the Trump administration in what she called dangerous federal level deception.
I'm shocked and appalled that the federal government would set an expectation with the American people on which they knew they could not deliver with such grave consequences. Their empty promises are literally playing with people's lives.
Governor Brown was not alone in criticizing the administration. In a tweet, Democratic Senator Jeff Merkley said U.S. Secretary of Health Alex Azar was deceiving states. Oregon's senior U.S. Senator Ron Wyden says this news will directly impact seniors in Southern Oregon.
Certainly, we were led to believe that there were vaccines available, particularly in the stockpile, and that those would be made available in Oregon for seniors and teachers. Now, I don't know what is worse, the lies or the incompetence.
The only Republican in Oregon's federal delegation, new U.S. Congressman Cliff Bentz, is also weighing in. In a statement, he said, quote, "I understand the concerns expressed by some regarding how the U.S. Department of Health and Human Services has handled the national stockpile of COVID-19 vaccines. However, I'm equally as concerned about the large number of undistributed vaccines by the state of Oregon," end quote. Oregon Health Authority Director Patrick Allen says many have not been distributed, but they are assigned.
We know sites are catching up on their data. We also know many doses have the name of a healthcare worker, a first responder, or another worker in a phase 1A group on them, but haven't been administered yet due to a range of logistical complexities and simple scheduling issues.
Allen said this shortage forces the state to make a tough decision. It will now prioritize teachers to get the vaccine towards the end of January, then seniors over 80 the second week of February, then younger seniors later that month.
But what we had anticipated being able to do with that reserve was speed up this process so that we could do, in fact, educators and seniors start them at the same time. So it takes away our ability to do that.
U.S. Health and Human Services Secretary Alex Azar told NBC News the U.S. does not have a reserve stockpile of COVID-19 vaccines, but it is confident that there will be enough produced to provide a second dose for people. Grace Smith, NBC 5 News.